learners, and welcome to this mini lesson. In this video, we're going to discuss more disorders of the nervous system, and this time we're going to focus on spinal cord and nerve disorders. Let's start with disorders of the myelin sheath, and remember, myelin is the fatty substance that surrounds the axons of the nerve cells and increases the speed of impulses. If the myelin sheath is damaged, nerve cells do not conduct impulses normally, or nerve conduction is slowed down. Demyelination is the destruction of an area of the myelin sheath that occurs in the PNS and can be caused by disease, inflammation, B12 deficiency, poisons, and some medications. Guillain-Barré syndrome is a disease where the body produces antibodies against the myelin, which leads to a loss of nerve conduction and results in muscle weakness and paresthesias. Paresthesias are abnormal sensations like tingling, burning, or prickling sensations, like that feeling you get when your foot falls asleep. The weakness and paresthesia generally starts in the lower limbs and progressively extends to the upper body and eventually leads to uncoordinated movements, inability to walk, climb stairs, and complete the ADLs or activities of daily living independently. Eventually, the weakness will become so severe that the muscles of respiration will become affected and the person will become dependent on a ventilator to breathe. Treatment involves the use of steroids, and recovery of neurologic function is very slow. Multiple sclerosis is the most common demyelination disorder and involves demyelination of nerve fibers in the brain, spinal cord, and optic nerves. MS is a chronic progressive disorder that causes weakness, pain, numbness, and vision loss. The disease is characterized by exacerbation and remission, which means there are episodes where the disease is worse and periods where the symptoms are almost gone. MS is more common in women and is usually diagnosed between the ages of 18 and 35 years. The exact cause is unknown, but it's thought to be an autoimmune disorder. Now let's look at some disorders of the spinal cord. There are different ways the spinal cord can be injured by trauma. It can be severed, or we say it can be transected, or contused, which is just another way of saying bruised, or it can become compressed by swelling or bleeding or a fracture. Any injury to the spinal cord will result in a loss of function below the level of the injury. Because of the way the nerve tracts run up and down the spinal cord, remember I described it in a previous video like an elevator, so any injury to the cord will stop the impulses from reaching the brain and there will be a loss of function below that level. If the spinal cord is severed, the loss of function is considered permanent until scientists can figure out a way to regenerate the nerves. Loss of function due to contusion and compression injuries can be reversed once the damage to the spinal cord has been healed. Spinal cord injuries, or SCIs, are more common in males than females. Cord compression can be caused by a herniated disc or a tumor in the spinal canal. Cancer or osteoporosis can also cause the vertebrae to collapse and compress the cord. Acute transverse myelitis blocks transmission of impulses up and down the spinal cord. Risk factors for developing acute transverse myelitis include Lyme disease, syphilis, tuberculosis, and IV drug use. Symptoms and signs of acute transverse myelitis include loss of sensation, muscle paralysis, and loss of bladder and bowel control. It has no specific treatment, and most people recover completely. Subacute combined degeneration is caused by a vitamin B12 deficiency. Symptoms of subacute combined degeneration include weakness, clumsiness, tingling, and loss of sensation of the position of the limbs. Remember, this sensation of knowing where your limbs are in space is called proprioception. The treatment of subacute combined degeneration is injections of vitamin B12. Poliomyelitis is an acute infectious disease caused by the polio virus. The symptoms include muscular paralysis, including paralysis of the muscles of respiration. Poliomyelitis, we usually just call it polio, can be prevented through vaccination. We haven't had a case of polio originate in the US since 1979 because of vaccines. Post-polio syndrome, abbreviated PPS, occurs many years after recovery from poliomyelitis. The signs and symptoms associated with PPS are tired, painful, weak muscles. Amyotrophic lateral sclerosis, abbreviated ALS, is also known as Lou Gehrig's disease. Lou Gehrig was a player for the New York Yankees in the 1940s who was diagnosed with the disease. He died at the age of 37, just 3 years after his diagnosis. In this motor neuron disorder, the motor nerves in the spinal cord and brain progressively deteriorate. There's no cure for ALS or similar motor neuron disorders. Okay, so those were disorders of the spinal cord. Now let's look at disorders of peripheral nerves. The term neuropathy is used to describe any disorder affecting one or more peripheral nerves. Remember, pathy means disease and neuro means nerve. So polyneuropathy simply means malfunction of many peripheral nerves throughout the body. For example, diabetic chronic polyneuropathy, sensation is affected and the person experiences paresthesias or numbness and tingling or burning in their hands and feet. And that numbness or loss of sensation can be problematic because patients can injure a joint and not be aware of it. This can lead to permanent damage to joints and can lead to what's called Charcot joint disorder, where bones and joints are destroyed secondary to neuropathy and loss of sensation. Herpes zoster is sometimes called shingles, and this is an infection of the peripheral nerves caused by the same varicella virus that causes chickenpox in children. The virus lies dormant on the dorsal root ganglia and is activated later in life for unknown reasons. It causes painful blisters and lesions along a unilateral dermatome. Pain can persist even after the rash is gone, and this is called a post-herpetic neuralgia. Remember, algia means pain, so neuralgia just means nerve pain. Mononeuropathy affects a single peripheral nerve. Carpal tunnel syndrome is compression of the median nerve in the wrist, often from repetitive wrist movements. Symptoms include numbness, pain, and tingling. Ulnar nerve palsy occurs when the ulnar nerve is damaged, and this is the nerve that's responsible for pain when you hit your funny bone. This can also cause paresthesias, or the pins and needles sensation, and hand weakness. Peroneal nerve palsy occurs when the peroneal nerve, which is located at the back of the knee, is compressed, and you usually see this in people who are bedridden or confined to a wheelchair. The neuromuscular junction is the spot where the neuron meets the muscle, and in this space, acetylcholine is the neurotransmitter that is released and causes the muscles to contract. Disorders occur when there is a disruption in the release of acetylcholine or ACH. In myasthenia gravis, the receptors for ACH are blocked and the skeletal muscles cannot contract. The characteristic symptoms are drooping eyelids, weak eye muscles, and difficulty talking and swallowing, and muscle weakness in the limbs. Botulism is caused by the same bacterium that causes food poisoning, Clostridium botulinum. This bacterium produces toxins that paralyze the muscles, which can include the muscles' respirations. Insecticides and nerve gases can cause neuromuscular junction damage in various ways that will interfere with the muscle's ability to contract. This slide provides you with a review of some of our terminology. Congenital means born with, so we use this term to describe conditions that you are born with. Gestation, remember, refers to pregnancy. Most devastating congenital neurologic anomalies occur in the first 10 weeks of gestation. Many of these can be prevented by the mother taking folic acid before conception and during the early stages of pregnancy. Teratogen is a word we use to refer to an agent that can cause malformation of an embryo and a fetus. We discussed this in the female reproductive system. Ultrasonography and amniocentesis are procedures used to diagnose congenital anomalies of the nervous system. We also discussed this in the female reproductive system. Okay, so let's talk about some of these congenital anomalies of the nervous system. And I'm going to give you a trigger warning here. Some of these images are not very pleasant to look at, and they involve newborns with some rather disturbing deformities. Okay, so the first condition is anencephaly, which occurs when a fetus does not develop cerebral hemispheres. This condition is not compatible with life. Microcephaly is associated with decreased head size and small cerebral hemispheres. It's associated with moderate to severe motor and mental retardation. Hydrocephalus is characterized by enlarged cerebral ventricles with excessive cerebrospinal fluid and increased head size. This is usually due to an obstruction that prevents the CSF from exiting the ventricles, and it can be treated by placing a shunt to drain the excess CSF from the ventricles into the peritoneal cavity of the abdomen, which decreases the pressure in the skull. Another trigger warning here for some possibly disturbing images. Spina bifida occurs in the lumbar and sacral regions of the spinal cord. when there is a malformation of the vertebral arch and spinal cord during fetal development. Spina bifida occulta shows no outward defect, only a hairy tuft of skin on the baby's back. And spina bifida cystica is characterized by an absence of the vertebral arch, which causes the meninges and spinal cord to protrude. There's two types of protrusions that occur. A meningocele is a protrusion of just the meninges, and a myelomeningocele is a protrusion of both the meninges and spinal cord. Remember, the suffix cele means hernia or protrusion, and myelo refers to the spinal cord. The term myelomeningocele can also be written as meningomyelocele, so either one of those is correct. The cause of spina bifida is not known, but it may be prevented by the mom taking folic acid prior to and early in pregnancy. Fetal alcohol syndrome is the third most common cause of mental retardation in newborns and occurs when a pregnant woman drinks alcohol. Typical features include small head, narrow eyes, flattened face and nose, mental retardation, and impaired growth. Pregnant women are strongly discouraged from consuming alcohol. And the abbreviations for this part of the chapter include ALS, which stands for amyotrophic lateral sclerosis. That was Lou Gehrig's disease. MS, which means multiple sclerosis. Polio, which is short for poliomyelitis. PPS is the abbreviation for post-polio syndrome. And SCI, which stands for spinal cord injury. And that's it for this mini lesson on disorders of the nervous system. I think we have only one more to wrap up this chapter. As always, I appreciate your attention, and I'll see you in the next video. Thanks.